Hello, this is Dr. Radhakeshini. Today we are going to discuss about the clavicle bone. Firstly, we shall discuss the topic from the anatomy, and I have taken upper limb as the first topic. In that specifically we will discuss the clavicle. Okay, let's start. This is the clavicle bone. It has two ends, the lateral and the medial end. The lateral end is quadrangular in shape and the medial one is a flat end. These are few points about the clavicle. It is the first bone to ossify and it is also known as the collar bone or beauty bone. It ossifies at 5th or 6th week of intrauterine life, and there are two surfaces in the clavicle. Those are superior and the inferior surface. Here is the superior view of the bone. It has, first of all, we have to divide the clavicle into medial 2/3 and lateral 1/3. How do we divide this? This is the medial 2/3 part and here is the lateral 1/3. And there are few attachments, muscle attachments to the superior surface, and here we go. This is the trapezius muscle which inserts in the lateral 1/3, anterior surface of the lateral 1/3, and anterior fibers of the deltoid inserts to the posterior surface. Sternocleidomastoid muscle is towards the medial part and clavicular head of pectoralis major is accurately the medial 2/3 area is covered by the clavicular head of the pectoralis major. This is about the superior view, and one thing is the superior part is actually smooth surface. The inferior part is a rough surface. It's because of ridges, tubercles, which makes the surface rough. And here we go. This is the inferior view. Inferior surface of the clavicle has subclavian groove. Subclavian groove, and the subclavian groove has subclavius muscle. It also has fascia known as clavipectoral fascia, and this is a ligament known as coracoclavicular ligament. The ligament known as coracoclavicular ligament, and medial side we have costoclavicular ligament. The lateral part which has coracoclavicular ligament, and there are tubercle known as conoid tubercle and the ridge named trapezoid ridge. The ridge named trapezoid ridge. So this is about the inferior view. It transmits weight from the upper limb to the thorax. So it helps in weight transmission. And one more thing is, nerve passes, middle supraclavicular nerve is passed. There is a nerve known as middle supraclavicular nerve which is piercing the middle part, medial part and the middle one. In the medial 2/3, we know this is the medial 2/3, and in that the middle part where this middle supraclavicular nerve passes. There are totally 6 muscles which attaches, and those are deltoid, trapezius, and clavicular part of the pectoralis major, sternocleidomastoid muscle. These 4 already we discussed, and in the inferior view we have seen subclavius muscle, and the other is sternohyoid muscle, which we can't visualize in this image. So those 6 muscles. And then ligaments. There are 3 ligaments. Interclavicular ligament, which is this medial side, attaches to the sternal end, which attaches to the sternum, and the lateral end attaches to the scapula. Here is the scapula and this is the clavicle, and the center part is the sternum. To the sternum the medial end attaches, and which has ligament, sternoclavicular ligament. Other 2 ligaments, costoclavicular ligament and coracoclavicular ligament. Coracoclavicular ligaments where there is a conoid tubercle and trapezius ridge, and this costoclavicular ligament is seen here to the medial side in the inferior view. So these are all the points of clavicle. Let's summarize it in simple manner. Clavicle, it is known as the collarbone, beauty bone, and it is the first bone to ossify. Ossify mean it is the first bone to form, and it has 6 muscles, and there are 3 ligaments, plus the superior surface is a smooth one. Inferior surface has ridges, conoid tubercle and trapezius ridge. Also it has subclavian groove where subclavius muscle attaches. Also fascia is present there, and the medial end is simple flat end. The lateral one is quadrangular end. There is a nerve which is piercing the middle part, and it is middle supraclavicular nerve. So these are all the points. Let's see in another video in the next topic, probably scapula. See you guys. Have a wonderful day. Thank you so much.